Chronic illnesses such as mast cell activation syndrome and fibromyalgia, as well as treatment-resistant infections such as Lyme disease and mold toxicity, are more common than you may think. For example, recent studies show as much as 14% of the U.S. population is infected with bacteria that cause Lyme disease. This is more than 46 million people believed to already be infected in just the United States. Lyme disease and many types of chronic infections can be related to general symptoms of illness like fatigue, brain fog, muscle and joint pain, so they often go undiagnosed or are confused with other disorders. Lyme disease and its co-infections is the #1 cause today of neurological, neuromuscular, and musculoskeletal problems, and is even called the great imitator, since it can mimic over 200 different illnesses. Unfortunately, it is often the case that allopathic medicine offers little help for people with chronic infections caused by bacteria, viruses, fungi, and parasites. This is because pharmaceutical solutions such as antibiotics are not always effective at permanently and completely fighting the underlying infections, nor do these medications by themselves address other underlying health conditions that may make your body susceptible to disease in the first place. Not only that, some medications can even cause worse complications than the infection likely would have caused, such as damaging the mitochondria, the energy factories of the body, and gut dysbiosis, making you feel worse for a long time before you feel better, and even threatening your path to recovery. Dr. David Jernigan of the Biologix Center, a doctor of chiropractic medicine and doctor of natural medicine, is world-renowned for his holistic and biological medicine-based approaches to treating infections and chronic disease. His innovations in the treatment of chronic illness go back decades, and his practice has seen thousands of successful recoveries. The Biologix Center is the only clinic in the world where you can receive personalized formulations of induced native phage therapy. In a recent study, INPT has been shown to facilitate the elimination of Borrelia, the bacteria that causes Lyme disease, more rapidly and efficiently than conventional treatments, with virtually no side effects. INPT is a natural therapy based on taking small oral doses of a silica-based electrolyte formula, which has been calibrated to induce naturally occurring bacteriophages already existing within the body to fight the targeted infections. The native bacteriophages are an underappreciated component of the body's regulation system that keeps every type of microbe from overpopulating in the body. Inducing native bacteriophages in this way encourages this part of your natural microbiome and your body to fight the infection with its own natural resources, which can rapidly eliminate infection while avoiding any adverse drug reactions such as in a herx or dysbiosis. When combined with Biologix's holistic and personalized clinical protocol, your body stands a much better chance of getting back on track toward health and healing. As such, INPT represents a new hope for people in search of effective therapeutics for treatment-resistant infections and chronic illness, who have often been unable to find relief from disease even after numerous interventions or long periods of treatment with various allopathic medications. Your doctors, even greatly celebrated doctors, may not know anything about INPT because it's not offered outside of a few facilities that are researching its benefits and effectiveness. INPT technology can be customized to fight a very wide variety of infections, and a range of standardized formulas are currently being developed, including those for chronic respiratory tract infections, GI infections, SIBO, mold infections, and UTIs. When combined with Biologix's holistic and personalized clinical protocol, INPT can help you get back on track to health and healing. We understand that not everyone is feeling sick for the same reasons or on the same path to recovery. You may need the careful attention of doctors who are vested in your body's individual journey and willing to go beyond the typical standard of care to find solutions way beyond just dealing with infections. You see, infections can be like termites in the wood of your home. If you find them and kill them before they cause serious damage, then everything goes back to normal. But if a lot of damage has already been done, eliminating the termites is not enough. The damage must be repaired before you can trust your house to withstand the next storm. That's why our treatment program is designed to offer all-inclusive access to the suite of advanced technologies, high-quality therapeutics, and educational opportunities offered at the clinic during your comprehensive 2 to 4 week visit, to not just help stimulate bacteriophages to eliminate the many infections, but to also repair the damage the infections and antibiotics caused. We know chronic illness may have you exhausted and desperate for solutions, but please don't put yourself at risk with medications that have been shown to be ineffective and damaging to your health. Instead, call today to let us see if this amazing holistic program of care at the Biologix Center for Optimum Health in Franklin, Tennessee can help you. We are committed to working with your body's natural design and restoring its ability to be resilient against infection so you can experience a lifetime of optimum health.
It was overwhelmingly the phages that tipped me over the edge to come here. It was a very easy decision for me.
The phages are a miracle, in itself. So the phage therapy obviously would be the top priority.
The phage therapy, that's I think a game changer for treatment, and I wouldn't be surprised if it's not around the world at some point in the future.
Pretty exciting because it's another thing where it's teaching your body, or it's helping your body fight the infection rather than just killing, a blanket number of bacteria or viruses.
The stuff they're doing at Biologix isn't happening anywhere else, and I think the native phage therapy is coupled with the therapies that the doctors do and the therapies at Biologix, because there's so many, when your body's so inflamed and so reactive, there's so many different ways you could get at different bacteria, but there's no way to really know what the body needs, and I think that the testing that they do here keeps you from wasting money on fluff that your body can't tolerate.
I struggled with parasites and getting better and then coming back, and so I was here about 6 months ago and I had my first phage, and basically I believe almost everything that we worked on is gone. Parasites were always like a number 1 or 2. They haven't even come up.
I had a couple chronic infections that they made a phage for, and even mold that they had made phages for. Pretty clear to me that they worked because this time coming I didn't have any infections, no viruses, nothing. So it's pretty amazing.
Okay, well, there's a huge difference between traditional medicine and biological medicine. For me and for my body, this is the only thing that worked, period.
So usually with the phage therapy, if they figure out that you have some type of infection, whatever it is, they will identify the strain of bacteria, whatever it is, and they can match your body to a treatment that's going to stimulate the bacteriophages in your body, which is your own infection fighters.
Quite honestly, you take your first phage and you kind of wait to see what happens next. And everyone's kind of different. For me, the doctor told me what he commonly sees, and I kind of fit right into that category. So I had a little bit of brain fog, I was a little tired, but really that was really all that I felt, which for most people in my position, when you do die off from Lyme disease, you're worried about the herx as much as you're worried about the treatment.
They said you might feel tired, and so I was into the second week of it. You take it 30 days, off 30 days. I noticed in the second week that I felt pretty tired by the end of the week, but it's really nothing compared to the benefit of getting better. Yeah, the phage is very exciting.
I'm very thankful for the phages. It takes you from hopeful to this is the real deal. And I felt better in the first 3-4 days than I felt in months.
I mean, that's their goal. Their goal is to have you be able to live life again. And I'm happy to say that I'm definitely living life again.
I came to Biologix for Lyme treatment.
The disease that I came for to Biologix was Lyme.
I have Lyme disease.
I was diagnosed with Lyme and co-infections and mold toxicity.
My wife and I are here for our son Isaac. He had Lyme and co-infections.
I think I was diagnosed 10 years ago, and it's been quite a journey to get here.
When I first started paying attention to what was going on in my body, the first diagnosis was a systemic yeast infection. So I started treating that for a while, and then it took about 2 years for them to link mold to that. And when I wasn't really responding to mold treatment, they found that I also had a lot of tick-borne illness, so Lyme, Bartonella, Babesia, Mycoplasma. Those are also there.
Didn't know that I had been exposed to a tick. I started having major dizzy spells, a lot of trembling, not being able to think clearly.
A lot of fatigue and brain fog.
It was very, very unpleasant and scary.
Getting through the day was a challenge at times. Lots of chest pain, lots of anxiety, overall feeling just completely off and not right.
I've been sick for decades because they told me I had fibromyalgia in my 20s, but I kept getting more and more symptoms. It wasn't until 2015 I had the IGeneX blood test that told me I had Lyme and 3 other co-infections.
We had spent a lot of time with our conventional doctors back home trying to figure out what was going on. They did an ultrasound, they did lab work, we went to the ER 3 different times, and we were constantly told it was in his head. And I was like, this can't be in his head. I knew he had Lyme. I didn't know how many co-infections he had at the time.
The first Lyme doctor I went to, he put me on 5 antibiotics at one time, but it was just too much for my gut. I wasn't feeling any better, and there wasn't a lot of follow-up, and even when I went back, it was almost like he just gave up on me.
Our first appointment, what we learned in 1 hour, was more than we had known in the previous 9 months on our first trip. So it was amazing.
When you go through something that is this horrible as Lyme disease, even though doctors see, people come through every 2 or 3 weeks or however long, it's amazing how fast you can form a connection with people.
It's a relief when you find out, well, there really is something going on and it really can be fixed. And this seemed to be the only place that was actually getting people well. You have to do the research and then find out where people are actually getting better, and that's where you should go.
With Lyme, there's multiple forms that they can kind of morph into. It's kind of a numbers game, if you will. Just like on a scale of 1 to 10 when you go to the doctor's office, is your pain a 9 or is it a 10? And then every day you go in with the doctor and you watch that number drop, is what I saw.
My life has changed dramatically. I've transitioned from a career in business to life coaching. From an exercise standpoint, I'm biking and hiking. I was hiking out west. I wasn't sure if I'd ever be able to hike again. I was able to hike with my wife and my daughter and my son.
I feel like a new person. Really, I feel like I got my life back. Very effective, very quick. And at the same time, I felt my energy rising, I felt myself get back to normal. This is an amazing place, and it's hard not to want to share it.
If you have Lyme or related, or you have stuff going on in your life that nobody can explain, this is the place to come to. I'm certain of it.
Biologix Center is different from any other facility in the world because since 2019, we have been innovating a new and profoundly important technology called Induced Native Phage Therapy. With this therapy, an oral dietary supplement called Inducen-ld appear to stimulate phages which already live inside your body, to work in tandem with your immune system, and to help eradicate your body's infections. Bacteriophages, often called phages, are harmless viruses that specifically target and kill bad bacteria and other microbes, while not infecting human cells. As when dealing with all living things, phages and bacteria don't always cooperate, so this new emerging technology, while exciting, is but one of the many tools our doctors use to facilitate your body's return to health. please visit our website at biologixcenter.com. We look forward to seeing if we can help you regain much of the quality of life you seek.